versus cancer. Let's get ready to rumble!
Hey, I'm Cancer. You may be wondering why we're here, why we're having this fight. Well, carcinogens is the reason. Carcinogens cause cancer by causing chronic inflammation, which causes a change in the size and shape of the cells. Some examples of carcinogens include alcohol, tobacco, occupational hazards, air pollution, sun exposure, infections, viruses, and obesity. Cancer can also develop from genetic predispositions such as having the BRCA and PSA gene. Well, I think I'm ready to win this fight.
Y'all ready for this?
There are multiple types of cancers. One type is carcinoma, which is in the epithelial tissue. There are also adenocarcinomas, which are in ductal or glandular tissue. Sarcomas are in connective tissue, muscle, and bone, and lymphomas are in lymphatic tissue. Leukemia is in the blood.
The process in which tumors cause the body to provide them with nutrients is known as angiogenesis. Like the growing plant in Little Shop of Horrors, the tumor sends out signals that essentially say, "Feed me." The messages from the tumor cause blood vessels to send over food and oxygen. In addition, the blood vessels provide a pathway for tumor cells to travel to neighboring and distant parts of the body. The movement of cancer cells to other parts of the body is known as metastasis. Metastasis is a complex process in which cancer cells break off from the original tumor and move through the body to form new tumors at new locations. From the point of view from a cancer cell, this is dangerous and often an unsuccessful process. To begin the process, individual cells must break away from the tumor and invade nearby blood vessels. The cancer cells catch a ride on plasma proteins and clotting factors and force their way inside of blood vessels. Once inside the blood vessels, some cancer cells may die from a variety of causes, such as they are unable to survive floating around in the bloodstream. Other migrating cells may become damaged and die when they squeeze through tight spaces, or may become recognized and destroyed by cells of the immune system. How and where the cancer cells stop is different for different cancer types. Once they find their home, they can begin forming new tumors by leaving the blood vessels and start reproducing in a new location. This does not always occur, and cancer cells can still die even making it this far. If the environment is suitable, the newly arrived cell will start to grow and a tumor will start to develop. One way the development of cancer is prevented is via death of defective cells. A cell that becomes mutated or damaged will first attempt to repair the damage. If that is not possible, cells will perform the cellular version of suicide, a process called apoptosis, which leads to the breakdown of key cell parts and the death of a cell. Cancer cells lose this capability and continue to divide. Cells divide in controlled and organized fashion with several mechanisms regulating division. Both types of cells, neoplastic and normal, pass through 5 gap phases. The first phase, G0, is considered the resting phase. G1 is the first gap phase and is where DNA synthesis is prepared with the help of enzymes. Phase S is where DNA synthesis occurs, replication of each strand to create duplicate DNA molecules. The next phase is G2. It is here where RNA and other specialized proteins are made. Lastly, we have the mitosis phase, where the cell divides into 2 daughter cells after going through the cycle of mitosis: prophase, metaphase, anaphase, and telophase.
Hey guys, I'm Amaris, and today I'm fighting against cancer with the help of chemotherapy. Chemotherapy refers to the pharmacologic treatment of cancer. The goal of chemo is to rid the body of cancer. However, there are many factors that affect the chances of success, including how effective cancer treatment is, the development of resistance to chemo, the cancer stage at the time of diagnosis, the type of cancer and its doubling time, and the health of the patient before diagnosis. When a cure is not possible, the goal of treatment is to make the patient comfortable and ensure the fewest adverse effects. A combination of drugs have proved to be more effective than single drug therapy primarily. Because drug-resistant cells develop and multiple drugs will have multiple mechanisms and site of action to aid in the destruction of these cells. Most of them have a fine line between therapeutic and toxic levels, so they must be administered with great care. White blood cells are constantly tracked throughout chemotherapy. After medications are administered, the lowest white blood cell count reached is referred to as the nadir, which normally occurs roughly 10 to 28 days after dosing, depending on the particular drug or combination of drugs that are used. Let's do this!
There are two types of cancer drugs, ones that work on the cell cycle and ones that don't. Folic acid antagonists such as methotrexate are specific to the cell cycle. These drugs inhibit synthesis of DNA in the S cycle by falsely substituting itself for a key metabolite. Indications for methotrexate include breast, lung, neck, leukemia, as well as rheumatoid arthritis and psoriasis due to its immunosuppressive effects of inhibiting lymphocyte multiplication and anti-inflammatory properties. Black box warnings include toxicities of major organ systems such as bone marrow suppression, renal, GI, hepatic, pulmonary, and dermatologic. This drug throws a mean punch. Because of its black box warning for myelosuppression, we need to monitor red blood cells, hemoglobin, and hematocrit, and monitor for anemia. If red blood cells are too low, the body does not get the oxygen it needs. In addition, we need to monitor platelets for complications of uncontrolled bleeding and/or hemorrhage. Leukocytes need to be monitored as there is a high risk for infection and immunosuppression related to bone marrow suppression. Immature neutrophils and band neutrophils provide a basis for the patient's immune system. Leucovorin is an antidote for folic acid antagonist and is always given in conjunction with methotrexate as a rescue drug to prevent healthy cells from dying due to lack of folic acid. Mitotic inhibitors such as paclitaxel are also specific to the cell cycle. An interesting fact about this drug is that there is a natural mitotic inhibitor that was originally isolated from the bark of the Pacific yew tree. Paclitaxel inhibits mitosis in the G2 and M phase by causing non-functional microtubules to form and is indicated for solid tumors. Black box warnings include bone marrow toxicity and peripheral neuropathy. This drug is hydrophobic and not tolerated well. Because of this, pre-medication with corticosteroids and H1 and H2 receptor agonists need to be administered prior to administration to prevent anaphylaxis. Because of black box warnings for myelosuppression, we need to monitor red blood cells, hemoglobin, hematocrit, platelets, and white blood cells. If there is one good thing to say about this drug, it does have a lower emetic potential. Alkylating drugs such as cisplatin are not specific to the cell cycle. The first alkylating drugs were developed from mustard gas agents that were used in chemical warfare during World War I. The first drug was known as nitrogen mustard. These drugs work by forming cross links with DNA, preventing its replication by a chemical reaction. Cisplatin is indicated for solid tumors such as bladder, lung, testicular, and ovarian tumors. It is commonly used in combination with therapy with other drugs to overcome drug resistance and reduce toxicity. Black box warnings include anaphylaxis, which may require a pre-medication, renal toxicity, ototoxicity, especially in children, and peripheral neuropathy. A major adverse effect of cisplatin is nephrotoxicity, so we need to monitor renal labs and renal function. Anaphylactic reactions can occur within minutes of administration, so we need to monitor signs and symptoms such as difficulty breathing, hives, swelling, nausea, vomiting, dizziness, low blood pressure, and rapid heart rate. This drug is only available in injectable form. One major drawback to the use of anti-neoplastic drugs is that nearly all of them cause adverse effects. 3 types of rapidly dividing human cells are the cause of hair follicles, GI tract cells, and bone marrow cells. Because most of today's anti-neoplastic drugs cannot differentiate between cancer cells and the healthy cells are also destroyed, so hair loss, nausea, vomiting, and bone marrow toxicity are the undesirable consequences. Effects on the GI tract and bone marrow are often dose-limiting effects. That is, the patient can no longer tolerate an increase in dosage that may be necessary to adequately treat the cancer and achieve good disease response. Final round!